Good morning. I am opening up the case for Veronica Duncan, a 15-year-old female who was recently presented to our clinic to provide a comprehensive overview, and I will begin with the administrative intake and the psychosocial context, which are critical in our understanding of the patient's current state. Veronica is an exceptionally high-achieving student athlete. Her schedule is demanding, and she is currently a 3-sport athlete, competing in soccer, softball, and basketball. However, the most significant recent change in her life is a transition to high school. During the intake interview, Veronica reported a high degree of anxiety regarding this transition. Nothing she has had a difficult time adjusting to the new environment and the increased academic expectations. We must also look at the family's medical history. On her father's side, there is a documented presence of type 1 diabetes and an autoimmune condition. Her mother is diagnosed with polycystic ovary syndrome, or PCOS. These hereditary markers are significant as we evaluate the patient's systematic health. Finally, for the record, Veronica has 2 confirmed food allergies, broccoli and mango. These have been noted in her chart to ensure that any nutritional or homeopathic recommendations made later in her treatment plan strictly avoid these triggers. Her chief complaint upon arrival has constant deliberating stomach pain that has persisted for 18 months now. I will now hand the report over to Nurse Gia for the clinical data.
Thank you, Gracie. I conducted the physical assessment of the patient. Upon examination, Veronica's vital signs were found to be within normal clinical ranges, which can often be misleading in chronic cases. Her heart rate was recorded at a stable 60 to 100 beats per minute. Her respiratory rate was 12 to 20 breaths per minute, and her blood pressure was 112/76. Despite these stable vitals, the patient's subjective symptoms describe a significantly deteriorating quality of life. Veronica has been experiencing this stomach pain for a year and a half, and she reports that it steadily worsened. In addition to the pain, she is suffering from persistent bloating and chronic constipation, unexplained weight loss, which is particularly concerning for a growing athlete, heightened food sensitivities, and a level of systematic fatigue that is beginning to impede her ability to play her 3 sports. It is important to highlight that Veronica is an active female with no history of sports-related injuries. This suggests that her fatigue and pain are not the results of overexertion or physical trauma from soccer or basketball, but rather a manifestation of an internal pathology. The duration of 18 months indicates that this is not an acute infection, but a chronic progressing condition that requires a definitive diagnostic path.
Thank you, Gia. Based on the clinical evidence and the patient's history of autoimmune markers, the diagnosis for Veronica Duncan is celiac disease. Celiac disease is a chronic immune-mediated disorder where the ingestion of gluten leads to damage in the small intestine. Specifically, the body's immune response attacks the villi, the tiny protorusions in the small intestine that are responsible for nutrient absorption. This explains why Veronica is experiencing weight loss and fatigue. Despite her caloric intake, her body is unable to absorb the nutrients required to fuel her athletic lifestyle. To understand why this is happening to Veronica now, we look at the history of the disease. While it was identified as far back as 2,000 years ago by the Greek doctor Aratus of Cappadocia, it wasn't until the 1940s that we understood the cause. A Dutch doctor, William Karel Dick, discovered that gluten was the trigger during the bread shortages in the Netherlands. We now know that celiac disease is most prevalent in North America and Europe, and it disproportionately affects females. It is frequently diagnosed in children and teens, often triggered by periods of high stress, such as Veronica's transition to high school. Regarding treatment, there is no medicine or surgical care. The management is entirely homeopathic in the sense that it relies on a strict, lifelong gluten-free diet. There is no middle ground. For Veronica to feel better, she must eliminate gluten entirely. The prognosis, however, is hopeful. While there is no cure, the small intestine has a remarkable ability to heal itself. With a strict diet, her villi can recover, her nutrient absorption will normalize, and she will regain the energy needed for her sports. We will continue to monitor her progress as she navigates this transition, ensuring her dietary plan respects her allergies to mango and broccoli while focusing on a total gluten-free lifestyle.